No surprise, the state budget is still not done, so the push continues to increase funding in several areas, and that includes community health centers. So joining us to talk about that effort, President, CEO of Syracuse Community Health Center, Dr. Ofrona Reid. Dr. Reid, good to see you again. Thanks for being here.
Likewise, thanks for having me.
So this is not just an issue about Syracuse. It's really about community health centers all across New York. How many people actually utilize these kinds of medical facilities, would you say, in New York State?
Yeah, so 2.5 million people actually utilize community health centers. That's 1 out of every 8 resident.
Wow, that's a lot of people. Where would you typically find these? We know obviously yours is in the city of Syracuse, but are they all necessarily in city centers? Are they in more rural areas? Like where do we typically find these? Or is there no so-called typical area?
No, you're correct. Usually throughout the United States, you'll find them in rural and underserved areas.
Okay.
But there's a misconception about who actually comes to the health center. Most people think it's just marginalized populations, but it's actually residents from all walks of life, socially as well as diversity.
Last week you had a rally with leaders from some of the other community health centers around the area. What kinds of areas were you guys really looking at? It's a funding issue that's really top of mind for you guys, right?
Yeah, it is. So we are projecting about 1.5 million residents will lose insurance this year or so. And so the issue is going to be where those patients are going to receive their care. So our concern is right now there's a proposed budget to increase funding to community health centers between range 60 to 100 million. We're asking for $300 million to kind of offset the increase in residents coming to our health center with no insurance, because as a community health center, we have to care for them despite they have insurance or not.
Oh, okay. And we're talking about the concern over things at the federal level of people falling off insurance, and now they've got literally, like you say, nowhere to turn, right? So now we're asking the state to pick that up.
Exactly.
Yeah.
Right.
It looks like they're trying to with that 100, but you're saying, and I say you, the collective you, are saying that's not nearly enough.
It's not really enough. A couple of reasons why. That will keep our head above water. Okay. However, we must understand that the cost of care for a patient has increased over the years. Our Medicaid reimbursement rate has been the same since 2016 or even before. Wow. So there's a big gap in between. So now if you add uninsured patient population, you got an increase in expense and no revenue at all.
Yeah. I've kind of heard that theme a little bit over and over. I've heard it from schools, the formula, and how we fund the formula, but more that the formula has not kept up with the times, essentially. So another case of that. I'm wondering what happens if the state can't go above that 100 million. Again, you tread water and just essentially, again, to use that analogy, try to stay above surface level as best you can.
Yeah, I think it's going to be a crisis, healthcare crisis. What you have to understand is that you have patients who have chronic illnesses who require maintenance, who require monitoring, education. And if I see them at Syracuse Community Health, because I return no one back, but try to refer them to a specialist, they won't be seen by a specialist. So now you got someone has high blood pressure, who would have complications from high blood pressure, leading to healthcare disparities, which will increase healthcare disparities. There's a report that came out from Onondaga County, the Department of Health, the assessment they do. Came out early 2026. Okay. And it showed, in one of the sections, the health status section, it showed premature death. Looking at those who died before age 65. It was highest in Hispanics, 55%, followed by blacks, 47%, and whites, 18.9%. So the impact it's going to have is going to continue spark racial disparities in health outcomes in our community.
Are you worried that people may not even come in the door at all? They're just simply kicked off of insurance and they don't even show up to see you?
Exactly. No more screening for cancer screening, breast cancer screening, colorectal cancer screening, cervical cancer screening. So what's going to happen is you're going to get lost, end up in the ER, flood the ER, and it's going to actually increase costs rather than actually decrease cost.
Last one for you. We've got about 30 seconds maybe, and maybe not fair, but I'll try to let you answer it. What's the impact on our community? So somebody might sit there at home and go like, well, I got a doctor, I got insurance, so I feel bad, but this has a bigger impact on the entire community, doesn't it?
It really does, because you think about it. If they don't get chronic care illnesses, they lag behind, or even acute problems, they're going to flood the emergency room department. And that's going to cause a healthcare crisis again. So we really have to avoid that.
Yeah. Well, Dr. Reid, I really appreciate you coming in and talking about this very issue, and would love to have you back again, because this is, I think, a good first crack at it, but it seems like a much bigger story. So we'll have you back.
Yeah, thank you. Thanks for having me.
Download the WSYR Plus app on your TV to stream News Channel 9 for free. Just go to your smart TV, search WSYR Plus in the App Store, and download to start streaming today.